Welcome to Ask the Expert on AKC TV, where we bring you the top experts on dog health, training, grooming, and more. I'm Marissa Sarback. Thank you for joining us. Today's topic, it is Poison Prevention Week. So for all matters health, we turn it over to AKC Chief Veterinary Officer Dr. Klein. Dr. Klein has been an emergency and critical care veterinarian for over 35 years. And so Dr. Klein, I am sure you have seen your fair share of poison pets come through that emergency room.
Well, not just coming through, but all the phone calls. I'd say that maybe 20% of the calls that we get were calls concerning owners with their dogs or cats getting into something. What should they do? Is it toxic? Is it worth coming in? So it's a common bread and butter part of being in ER, ICU units.
And I'm sure it really changes depending on what it is that your dog has gotten into.
It does. It changes depending on the size and weight of whether it's the dog, whether it's a dog or a cat or other animal. It changes by the times of the year, the season of the year. Certain things are more prevalent during certain times of the year. And it's changed through the decades as certain drugs or certain things are more prevalent and are either legalized now or not. And some of them are common and some of them are illicit drugs that are sometimes come in as well.
So probably that number one question is going to be, if my dog has been poisoned, what do I do?
The first thing you should do is try to stay calm, try to have an idea of what it is your dog or cat got into, and you should call your veterinarian or a pet poison hotline number, which should have easy access around your house. If you own a dog or a cat, you should have several numbers like on magnets on your refrigerator or by your phone that should be your go-to things. Your veterinarian, an after-hour emergency number in case they're not open, and the phone number of either a pet poison hotline or something of that nature. And be able to describe as well as possible the time and what it was and approximate amount. And if you have to, take a photograph of it on your cell phone and then act accordingly. Certain things may require you to go in as soon as possible to some kind of facility to have action done. Some things may not be problematic and you'll be able to take a sigh of relief. What you don't want to do is do nothing. Certain problems may not show up for a while. Certain things are obvious right away. Certain things may take hours. Certain things may take days.
And we do want to talk about those numbers that people should be calling into and who they should be going to. There is also a special deal for dogs enrolled in AKC Reunite. We're going to bring that up on your screen right now. And this is just a few of the numbers and things that people should be calling, right, Dr. Klein?
It's very important because these are people that have the knowledge and the guidance that you'll need at these times of a crisis. And it is a crisis, at least in your mind, and it could be a life and death type of decisions. So this is something where time does matter. You don't want to just take your time about it. You want to make that phone call and make it a priority. These services may charge a fee, but it's a small fee in price of saving your dog or cat's life, or if it has to go to an emergency facility, which requires several days of hospitalization and having your dog or cat's life at stake, that could be thousands of dollars. So paying a modest amount, whether it's $59 or whatever it is the fee is at that time, is well worth it just to get the guidance and the know-how what to have.
And I know you always say that the most important thing really is prevention. So you don't have to get to that point where you'd have to call a vet, go to a vet, call a number. What can we keep in mind when it comes to preventing our dog from getting into something?
Well, I hope that what this is going to tell people is what they should be aware of and things around their house that could be problematic that they should keep an eye on and try to keep out of the way of a dog and a cat. And let's face it, they're like kids. They're going to be everywhere in places that you're not going to be. They're at a different eye level than we are. So the obvious thing is make sure your garbage is kept out of, in a closet and either locked or closed with certain kind of, closures. And I know there are certain dogs that get into it. They're like circus dogs. But that being said, the majority of us are smarter than our pets. Some are not. But we have to do what we can to try to limit the access to that. Make sure that things are out of the way of the counter, that things are not set on their level of coffee tables. And so different things can happen. During the holidays, we may have guests in from out of town. They bring in their own sets of luggage or handbags and put it on the floor with their Ziploc bags of their various medications of unknown amounts, unknown milligrams, and lo and behold, your dog loves to get into that bag, and we, as an emergency clinician, our favorite calls, not really, are my dog got into my friend's Ziploc bag that has what? We don't know. How many milligrams? We don't know. So first thing, keep it out of their reach. And then if they're going to come and visit, make sure you let them know to not have it at floor level, and make sure your dog and cat's not available to that. And ideally, if they can, or if someone can, medication, they should be photographed on some kind of cell phone, the label, so at least you have an idea of, you know, when it was prescribed. So if it gets into, you have an idea how many may have been ingested, because the amount of medications or drugs, the time and the weight of the dog and the cat are all critical in trying to figure out a plan to try to treat that dog.
And probably one of the big rooms or biggest offenders in your house is going to be the kitchen, because there's so much food for them to get into.
Right.
What would you say are those major foods that we should stay away from, be aware of?
I think the obvious things that people know and should know, chocolate is the biggie. And of course, the general rule of thumb is that the darker the chocolate, the more problematic it will be. White chocolate is not toxic, and a big dog eating something like a Hershey's Kiss is not going to cause an issue. Raisins and grapes, however, are even more important because they can cause kidney damage. Alcohol and coffee and caffeines, and then all items containing sugarless substances like xylitol, sugarless gums, and a lot of baked goods and even peanut butters can contain xylitol as well. So read the labels and keep them out of their reach.
And is there a level of toxicity for certain items over others? Like, is there maybe grapes are more than chocolate, they're more toxic?
Well, I think that grapes and raisins may not show up for the 48 hours, and they can cause more problems. They can cause kidney damage. Xylitol, depending where in the list of ingredients it is, certain flavors of sugarless gum, certain flavors have higher levels of xylitol, so that can all be very different. So you should read the label and also call, they'll help you guide you.
Any other foods we should be aware of in the kitchen?
I think cooked bones can be concerning. They're not toxic per se, but they can cause obstruction and surgical concerns. And other medications in the bathroom are also problematic as well. So cooked bones are really bad. Macadamia nuts can be toxic. And then yeast and yeast dough can ferment in the gut, and they can cause bloat. I've had a dog with that and other issues as well.
All right, thank you. Anything else moving on when we are talking about, your furniture polish, cleaning, anything like that?
Well, those all contain chemical ingredients, and they're especially concerning before they dry. So if you're using a carpet cleaner or furniture cleaner or polish, the dog should be or cat should be out of the way when it's being used until completely dry. The vapors can be problematic, or if they're licked, it can be problematic. And the same thing with bathroom cleaners as well.
And just a few of the other things on our screen right now, those air fresheners, can that be problematic as well?
There's been concerns about those and how problematic they are. Again, try not to do it in the direct area where the bedding are. Make sure it's dried. Try to vacuum try to use more of the vacuum than anything else, and try to keep things clean in a more natural way if possible.
And in terms of the drugs, I know you were talking about it earlier, of people bring things to your house and they may have it in a Ziploc bag, but what about drugs in your own house, in your own drug cabinet?
The most common ones that we get are the non-steroidal anti-inflammatories. Those are the drugs used for like arthritis or headaches, ibuprofen, acetaminophen, and naproxen, like Aleve. So those can be very toxic. It can injure both the gastrointestinal tract and also the kidneys and liver. One thing we should be aware, those are human ones, and so dogs can get into that. But also the veterinary ones that are prescribed non-steroidal anti-inflammatories, because they're usually chewable, so they taste good. So a dog's supposed to get half a tablet twice a day. They may get into the jar and eat the entire jar. So that's an overdose as well.
And moving to a different room now, what about the living room? Anything in there?
Well, watch your electric cords, because especially puppies love to chew on things, and the chance of electrocution can be high, and that could be very serious and life-threatening.
And moving on to the garage now. We're just going to do this room by room.
Well, the garage has its own concerns, especially chemicals. Ethylene glycol or antifreeze is extremely toxic. It tastes sweet. Dogs and cats love to lick it, and it can be fatal.
And is there a concern with that coming out of your car, or a concern more with the cat getting on top of your car?
It leaks from the car or any open containers. So if you don't have a good observant of it, it can be very, very problematic.
And then even not only in the house, but also outside the house. I mean, that yard, the garden, all around your house, you could have issues as well.
Well, you have pesticides, and most pesticides are always a concern until they're fully absorbed or after first good rain or watering. So if they're still on the ground, they're fresh, that could be, I would not have my pets out. Certain plants, especially the bulb plants, are toxic to dogs. So things like tulips are concerning, and hyacinths. So those are especially problems if they eat or ingest the bulbs, so when you're first planting them. And as a secondary concern, we should mention for people that have cats, they're very attracted to lilies, and they're extremely toxic to cats. They can cause kidney failure and even death in cats.
And coming up on Easter here, I mean, we're going to assume that a lot of people are going to have lilies in the house.
Yeah, people seem to be really concerned about chocolate. I'm more worried about other things, probably grapes and raisins for dogs, and certainly lilies for cats. I think for us in an emergency, those are the ones that cause the most problems, are the costliest, and the ones that really keep an eye on.
Is there any way to really know that your dog has been poisoned with something? If you didn't see them eat it?
Well, that's the whole thing. Observing it is obviously the best way, and sometimes we find telltale signs afterwards, a chewed up box of something or something else like that. Sometimes people bring a dog or a cat in because they're acting in an unusual manner, and then we have to ask questions. Is there any marijuana in the house, or any other drugs in the house the dog could have gotten into? And certainly in this day and age of legalization of certain drugs and edibles and things like that, emergency rooms, veterinary emergency rooms, and human emergency rooms, I think, are seeing a lot more of toxicity with marijuana, and so they have their own classic signs. So a good history and an honesty and transparency from an owner answering questions, they're not going to get into trouble. We're not trying to get them into trouble. We're trying to get as much answers as we can so that we can hopefully try to solve the problem. And even things like laundry detergents and those pods can be very caustic to the gut and can cause problems with the esophagus. So household items can be very problematic. So you have to keep an eye on everything and just look at it with a different eye.
What else would you say we're going to see in that laundry room or maybe bathroom, attic?
Be careful of like dryer sheets. They can be kind of very irritating and concerning. And fabric softener, certainly bleach, access to bleach can cause esophageal strictures, and those can be very concerning and even deadly as well.
Would you say there's a most dangerous room in the house, or really can any room be the most dangerous?
Life changes. I think depending, you can't bubble wrap an animal, you can't bubble wrap a child. They have to live their lives, and you have to live yours as well. What you're trying to do is be aware, minimize the possibility of occurrence of these things happening by protecting them as much as possible, being aware, and doing the right thing at the right time when you discover something happened. They're called accidents for a reason, because it's an accident. No one wants it to happen, but once you're aware that it could happen, knowing what to do can hopefully make a difference in what happens as the outcome.
All right, and one more time we want to touch on what that prevention will be if you suspect that your dog might have gotten into something. So who should you really be calling?
Always call your veterinarian, and if they're not, they should have a 24-hour emergency number, and there's also pet poison hotlines. Sometimes they'll direct you to do induced vomiting, and that's rare, but it could be done. And so the one thing you should have around the house is hydrogen peroxide, and we usually recommend administering the amount as mentioned by your veterinarian. Easiest to do it with like a turkey baster. It's not easy to get hydrogen peroxide. No dog wants to drink it. Kind of a wives' tale that does not work and you should never do is give oil as an antidote. I think in some communities, they used to recommend giving olive oil or castor oil. That actually is one of the worst things you could do because a dog could actually vomit and aspirate the oil, and that could cause a much worse problem. So do not do that. So just because somebody tells you to do something, if it's not an expert, don't do it. Talk to an expert and do the right thing. Never do anything on your own without consulting with someone first.
All right. Anything else that people should be aware of?
No, I hope it makes some difference and maybe save a life or two or more.
Absolutely.
Yeah.
Thanks so much, Dr. Klein. Appreciate your time.
Thank you.
All right, that is all for today. I'm Marissa Sarbach. Thank you for joining us. We'll be back next week with another Ask the Expert, and that is in addition to AKC Dog Center, where we bring you the latest dog news from the American Kennel Club. Those are on Tuesdays and Fridays at noon, so stay with us. And be sure to download AKC TV on Apple TV, Roku, and Amazon Fire. Also follow us on Facebook, Instagram, and Twitter. Chat with us on social media. AKC TV, sit, stay, watch.